So much, District Attorney Harrington. So really liked your point about how this is a continual push and young people are at the center of change and can really make such a big difference. And I hope that this next speaker will help you, take care of yourself and take care of your friends so you can really push for change. So we have Wendy Penner next. And Wendy Penner worked at the Northern Berkshire Community Coalition as Director of Prevention and Recovery from 2015 until recently. In this role, Wendy coordinated the community-based youth substance use prevention and addiction recovery efforts in North Berkshire County. She is a PhD organizational psychologist who is passionate about thinking globally and acting locally. She has lived in Williamstown for 30 years and raised 2 daughters with her husband, Steve.
Thank you so much, Ben. I'm so happy and honored to be here today. And I want to thank Brian House from the District Attorney's Office. And I want to thank the members of the Youth Advisory Board who I had an opportunity to speak with earlier in the year for this important work. I'm going to share my screen in a minute and share some slides with you all. I want to say that for me, what I really love about this conference is that in my work, the voices of young people have had a tremendous impact on me, and that I think that we need to create more opportunities as a community for adults in the community to understand and hear the issues that you're confronted with as you come of age. And I'm going to go ahead and share my screen now and share some slides and say a little bit more about some of that. So just picking up on, I'm going to just start a timer here so that I don't go on too long. So picking up on some of what District Attorney Harrington was saying, and also what Carolyn was saying, this really has been an incredible year. It's an incredible time for our planet and for our country, and that you young people are coming of age during this time of COVID-19, the twin pandemic of racism, climate change awareness, incredible political divisions and transformations in our country. This is going to be very formative for you in your life. And what I loved, I think when I was probably your age, when I was first exposed to this symbol, the Chinese word for crisis is made up of 2 characters, danger and opportunity. And what I love about this is that with crisis does come the opportunity for change and for doing things differently. And I think we can all agree that, this is a time when that opportunity needs to be seized. And one thing that I learned in graduate school is that when you present people with information and you frame it as a crisis, they actually come up with fewer solutions and less creative solutions than when you create it as when you phrase a problem or a challenge as an opportunity. And when we feel overwhelmed or discouraged by the scope of the challenges that we're facing or the crises that we're facing, I think it's really important to remember that people are we are really very resilient, and really that young people, that you are our hope, and that the adults in the community look to you for inspiration and listen to your voices, and that they really have an impact. And when we talked about these epidemics, I want to reference another epidemic that we're facing in this country, which is the epidemic of addiction. And the work of the District Attorney's Office, much of that is focused on the fact that we have a lot of people whose lives have been really impacted by addiction. And in fact, they end up in our jails. And their families and their lives are being devastated by it. So how can we prevent that? Well, addiction starts with the choices that we create for our young people. And so my work at the Northern Berkshire Community Coalition was funded by the state of Massachusetts. And it's really focused on how can we create communities that support healthy choices by young people. So it's not just saying, how can we tell kids the right choices to make? Because being a young person is exciting, it's challenging. There's a lot of interest in exploring new things and having new experiences, and that's as it should be. But how can we create an environment where those choices are healthy ones? So I wish I could see everyone's faces while I talk about this, because I'm going to speak about a really important tool in Berkshire County that we use to help us in this work, which is a student health survey called the Prevention Needs Assessment. And this is a survey that young people are asked to complete in school every 2 years in 8th, 10th, and 12th grade. So because you are 8th graders here, I'm hoping that many of you are nodding your heads because most schools in the county just administered this survey this month. And I hope you had a chance to fill it out, and that maybe we'll have a chance to talk about it in the great breakout groups. So this survey administration is a partnership between schools and community-based organizations, and it asks students to answer a lot of questions. And the answers provide information about young people's use of young people's risky behaviors, including substance use, such as vaping, alcohol use, marijuana, and other drugs. And it also asks you all to answer questions about yourself, your families, your school, your home, and your community environment to understand what might be influencing those choices. And the way that we like to talk about this student health survey and this assessment tool is it's a report card from young people to the community to tell us how are we doing in creating an environment that supports healthy decision-making by our young people. And your responses are very helpful and informative to the adults in the community. So what does that data look like? So this is a graph from the 2 years ago when the survey was administered. And you can see 3 clusters of bars here. And the first one is for 8th grade. The second cluster of bars is for 10th grade. And the third one is for 12th grade. And the different colors represent different substances. So blue is alcohol, red is tobacco or cigarettes, green is e-cigarettes or vapes, and purple is marijuana. So what we see is that in 2018 or 2019 graduation, kids who graduated in 2019, that 8th grade use, about 11% of 8th graders in Berkshire County reported that they had used alcohol in the last 30 days. That's what the question is. And that when you get up to 10th grade, that's almost 25%. And when you get up to 12th grade, it's 40%. And what we see here is that alcohol is the #1 substance that young people are experimenting with, and that is pretty typical. But that tobacco use levels have gotten very low, and that's a big success in the prevention world, because it used to be that smoking cigarettes was one of the biggest substances young people were experimenting with. And then we see that the vaping is high, and that's a newer substance, and that marijuana use levels are there as well. And the thing I want to point out about this graph is that in 8th grade, levels are lower, and then that there's a big jump to 10th grade and another big jump to 12th grade. And in our work around substance use prevention, what we want to do is bring all of those numbers down. So actually youth experimentation with substances in Berkshire County is a little higher than the national norm. So we'd like to get below. We'd like to see our 8th graders using substances less than their peers nationally. And what we actually see is that it's more. And then we'd like to see those jumps decrease. So, you know, I think one really interesting question and challenge is hopefully this means that the vast majority of you haven't used alcohol in the last 30 days, or at least as of 2 years ago, the 8th graders hadn't. And we would like to say, how can young people help us understand what are the factors that are contributing to their decision to use alcohol or their decision not to, and how can we do better with those, creating more of those factors? So like, right, so if it's like, I don't use alcohol because none of my friends do, well, we want to say, okay, what are the attributes of that friend group? You know, what's the education or supports or a school environment that they're in that are contributing that? So this is the data that I was just talking about. It's just to give an example. This is just alcohol. And if you look at the first cluster of graphs, that's the last 4 surveys that we've done. How much alcohol were 8th graders using. And what you can see is that yellow bar is showing that 8th graders in Berkshire County were using more alcohol than their peers nationally. That's that green bar. And 10th graders also. You can see that even though we've seen this nice reduction in alcohol use over the last 4 student health surveys for 10th graders in the middle cluster, that our 10th graders are still using more alcohol than their peers nationally.
Do you know how many kids are on the call?
And similarly, the same thing for 12th graders. 12th graders, alcohol use is remaining high. We can see that 50% of 12th graders have used alcohol in the last 30 days. And that's more than 40% of peers nationally. So hopefully looking at the graph isn't too confusing, isn't complicating things unnecessarily. But I want to move on to talk about, to talk about this early use and why early use of an experimentation is especially concerning. And what this graph shows is that young people who begin to use alcohol at below the age of 14, that of those young people, 47% of them go on to develop a substance use disorder or addiction. And 17% of them go on to experiment with illegal drugs. That's what that first set of bars shows. And what this graph shows is that each year that you delay beginning to use alcohol, the overall risk of addiction or the likelihood of using illegal drugs decreases. And that's an outcome that we want. I think that in our culture and in our country, there's this idea that, hey, it's normal for kids to experiment. And certainly being curious is very normal. But that normalization, what comes along with it is the idea is that it's not very harmful. Hey, I did it when I was a kid. And I really want to challenge you around that, because what these charts show is that the age when you begin to drink actually really impacts your lifelong risk of developing an addiction or a substance use disorder, and in this case, alcoholism. So that little tree here is the brain. And the reason that early use is so harmful is because, as I'm sure you've been told, your brains are still developing, and that the mature, fully developed brain that we don't have until we're in our 20s is affected by alcohol or substances very differently than the adult brain. So how are choices made? How do young people, why do they decide to experiment or not experiment? Well, you exist in a family, a peer group, and a community that all influence your choices. So do you and your peers look at vaping as fun or gross? Do you and your peers look at alcohol as exciting or unhealthy? These are questions that we want to understand, and it's very important to talk about. And how can our communities do a better job of supporting young people to make healthy decisions? So that is prevention. And when we are doing this work, we talk about risk and protective factors. So a protective factor might be saying, I have healthy communication with my parent. I understand their expectations. I can ask them questions. Or a protective factor might be, I have a school environment where I feel seen and heard by the adults, and I'm given lots of opportunities to succeed. Or a risk factor might be, I'm getting lots of information and messages that using drugs or alcohol isn't really very harmful, so therefore I'm more likely to do it. So another risk factor is mental health. So one reason that people use substances and that young people use substances is because they're depressed or they're anxious or they're just not feeling very good in the moment. And using substances is a way to feel different. And so we know that nationally, young people are struggling more and more with mental health issues. And I've been so impressed to see the work of Ben and others across the country to respond to this growing need and awareness about creating more supports for young people as they encounter mental health struggles. So your choice and your voice really matter. When you speak out about issues that are important to you, or about what you're struggling with or what your hopes are, that has a very big impact on the adults in the community. So I'm just going to close by saying, oh, and this is the mental health piece that I was talking about. One last chart, which is these gray bars show that in our last student health survey, this depressive symptoms measure increased substantially. And that's not just in Berkshire County, that's a trend across the country that we're seeing young people's mental health concerns are rising. And that's something, that's a risk factor. So that's something we want to be responsive to. So as I close, just returning to this crisis and opportunity signal, you know, in the coming years, you're going to be faced with decisions, you're going to be faced with opportunities, and I hope that you will take advantage of the supports that are available to you in your community. I know in North Berkshire, there are some ways that you can use your voice. Talk to your parents, find a trusted adult, be a friend to those who need one. When you feel strongly about something, look for ways to express yourself, and that there is a network of youth serving organizations across the county working to lift up the voices of young people. And one of these is the Northern Berkshire Community Coalition. And we offer some wonderful youth programs that give young people the opportunity to use their voices and be heard and connect with each other. And of course, the youth advisory board of the district attorney's office is another wonderful program. So thank you so much for this opportunity to be with you today. And I'm really looking forward to hearing more from you all. Good luck with everything.